Did you know that not all pregnancies present with noticeable symptoms? That's right. While some women may experience morning sickness, fatigue, or breast tenderness, others may not notice any changes at all. This phenomenon, known as an asymptomatic pregnancy, is more common than you might think. So why do some women have pregnancies that seem to fly under the radar? Well, there are several reasons, and they all come down to the uniqueness of each individual's body and the complexity of the pregnancy process itself. Firstly, we must consider individual differences. Every woman is unique, and so is her body's response to pregnancy. Some women might not experience any noticeable symptoms simply because their body reacts differently to the hormonal changes that come with pregnancy. Speaking of hormones, they play a significant role in pregnancy symptoms. From nausea to mood swings, hormones govern a lot of what goes on during pregnancy. However, hormone levels can vary greatly from woman to woman, and those with lower levels of certain hormones may experience fewer symptoms. Next, let's talk about timing. The early stages of pregnancy can be quite subtle, with symptoms either being very mild or not present at all. As the pregnancy progresses, symptoms often become more pronounced, but this is not always the case for every woman. In some instances, an absence of symptoms might actually indicate a healthy pregnancy. Yes, you heard that right. Not experiencing symptoms doesn't necessarily mean that anything is wrong. In fact, it could be just the opposite. However, it's also important to mention that miscarriages can occur without any noticeable symptoms. This isn't to say that the absence of symptoms always indicates a problem, but merely a reminder that miscarriages can happen for a variety of reasons, and they are not always related to symptoms. Lastly, individual perception plays a big role. Some women might actually have symptoms but fail to recognize them as signs of pregnancy. They might attribute these changes to other factors like stress, diet, or changes in their routine. So, if you suspect you might be pregnant but aren't experiencing typical symptoms, what should you do? The best course of action is to consult with a healthcare provider. They can run tests and guide you based on your individual situation. Remember, regular prenatal care is essential for tracking the health and progress of your pregnancy, whether you're experiencing symptoms or not. Because when it comes to pregnancy, it's always better to be in the know.